there, welcome, and thank you so much for spending some time with us tonight for our skin tightening and lifting presentation. I am Amy Katsikas, the owner and founder of Pure 111 and an advanced practice nurse.
Hi, my name's Shannon Riley. I am a licensed esthetician here at Pure 111. I am the Sofwave provider, and stay tuned to our live Q&A where we are going to unlock promotions when you hear the magic word.
You're going to be able to enter questions that you may have about this amazing new technology called Sofwave at the end during the Q&A. And just for attending this evening, we have entered you into a raffle. We will be emailing the lucky winner of that, and they will receive a $250 Leono restaurant gift card. They will also receive a free Sofwave treatment and a Skin 111 regimen. So what exactly is Sofwave? It is an FDA-approved device for skin tightening of the chin, neck, and brows. It also recently got FDA approval for the lax skin under your arm. What I loved about it and why I brought this on, in addition to our clients having concerns about laxities or lower face, is that there is minimal to no downtime.
Sofwave is a form of regenerative medicine and is little to no downtime, which is perfect and why we wanted to bring it on for our clientele.
Yes, I really do think more and more people are looking towards doing things regeneratively and utilizing the power of their own body, which this fits right in with the overall health and wellness.
Sofwave is different from other devices in the aesthetic industry because it is using superb technology, which is synchronous ultrasound parallel beam technology, going into the mid-dermis where our collagen and elastin and hyaluronic acid is found, which is causing no epidermal injuries to the skin, making sure that there is little to no downtime. It is a great form as regenerative medicine. And I think that is why we brought it on for the practice, because our clientele is totally loving that.
And when she says little to no downtime, I went to the Justin Timberlake concert the night of my treatment. So it's true. So what can Sofwave all treat? It is FDA approved for a little bit of a brow lift up to about 4 millimeters, the chin and the neck. So primarily that area that you're starting to see some lax skin in that lower face, it's great at tightening up and lifting.
Not only does it treat the face, but it also is FDA cleared to treat on our body as well. So anywhere where in the arms they have some crepiness and lax skin, along with the abdomen region, and it also can treat cellulite and acne scarring.
So who is a good candidate for Sofwave? This is amazing news because you are, and you are, and you are, and you are, and I am.
The best part about Sofwave is that it's perfect for everyone. It's great for all skin types, all ages, and all skin tones. The best thing about Sofwave is that there is minimal to no downtime using this device. That is why we brought it on to the practice, because who doesn't love no downtime? You will start seeing your results maybe immediately. It depends on you as a person, but you'll see your maximum results at 12-week mark.
Perfect. And in the studies, it showed that just doing an annual kind of maintenance treatment is best.
And then we will have you come follow up at that 3-month mark to kind of decide on if you want to do that second treatment or you were okay with just that one treatment. And then we can discuss, like you said, further on with monthly maintenance or just maybe a yearly maintenance.
So I have our beautiful patient here, and she has, hope you don't mind me saying, lost a significant amount of weight recently. Congratulations, by the way.
Thank you.
And she is just starting to notice, because of this, feeling some laxity in her lower face from the weight loss and from age, unfortunately, too. Not significant at all. I would really consider you just kind of a moderate laxity person. So we would want to look at her lower face to treat, as well as the upper neck. And turn the other way for me. And this is just going to give her some lift and tightening to her jawline. A lot of women after a certain age really are complaining of some jowling in this area. And that is one of the things that Sofwave has been just phenomenal for. And then face the camera for me. So her brow position is perfect and beautiful. If she would come to me and say that she'd like to get a little bit more of a lift to her brow, Sofwave we can treat right underneath the brow bone there and give up to a 4 millimeter lift to this area. So people are really loving that. She has sleeves on, but another area that a lot of our patients are complaining of is the laxity in the arms. And we're seeing amazing results tightening up that lower part of the arm. So I would treat her as moderate. She most likely would not need a second treatment, but I'd want you to come back in about 3 months for us to evaluate. And at that time, if she wanted some improved results, we would talk about a second treatment at that time. Thank you so much for spending some time with us this evening for this virtual event. We hope you enjoyed it. Make sure you stick around for the live Q&A in which you can ask any questions.
Make sure that you check your text messages where you will be able to book any consultations and get on the books for the Sofwave treatment.
There we are. All right. Hello, guys. Thank you so much for spending time with us tonight. There's a ton of questions coming in, but again, I just wanted to introduce myself. I'm Amy Katsikas. I'm a nurse practitioner and the owner of Pier 111.
I am Shannon. I am a licensed esthetician here at Pier 111, and I am also the Sofwave specialist here.
We just want to remind you real quick before we get to this list of questions that you are all, just for joining, entered into a raffle tonight. We are going to pick that tomorrow and we'll be notifying you. The raffle consists of a Leono $250 gift card. It's a local restaurant in O'Fallon that's amazing. You will get a free Sofwave area treatment, and then our skincare line, Skin 111, you guys will get a regimen of that. So all three things, one lucky person, and we will let you know that tomorrow. Okay, I guess we started on these questions.
Yeah.
And excuse me, but I am over that age that I need these, unfortunately.
And I don't have my glasses, so I will be.
This is a real deal. Okay, it looks like we're gonna dig in, because if they're asking it, you guys probably are asking it too. One of the big questions, I'm curious about the cost. Absolutely, and I'm gonna let you speak to that.
Yeah, the cost varies depending on what you're getting treated and the severity of the treatment area. With this treatment, you can treat in the face area and other body parts. So it does kind of vary on pricing. I would say from the range, it can be from $750 to $2,800. And of course, if you want 1 to 2 treatments. So again, it just kind of varies. And each treatment is
About 30
like
minutes.
30 minutes to an hour.
So we do have you come in for a consultation first, at which time Shannon would assess you and say, okay, you're a moderate or you're a severe. We're going to treat you as such, and you will know exactly how much your treatment would be at that time. Regarding the time frame, again, it depends. Are we just doing lower face? Are we doing lower face and brow lift? Are we just doing neck? We do numb you for this. I'm sure one of the questions is about some discomfort. So we do numb you for this. There's something that popped up here. For this procedure, about 30 to 40 minutes with a pretty heavy duty topical medication. But we have literally had some people say, I don't need that this time. I don't want that. And their pain level is like a 2 to 3 on a scale of 1 to 10. I had it done. I'm probably the biggest wimp there is on earth. And I tolerated fine. So
and you went out that night.
I went out that night during the procedure. It was fine. I'd say for me, it was maybe a 4, but very, very tolerable. We also give you what's called a Zimmer chiller, and it's like a cooling hose that if you want, you can use on your face. The device itself, and I wanted to bring one in and I'll show you guys the machine that we actually use, but it's kind of a, how do you describe it? Warm, or cool?
Cold, warm, hot, as far as the discomfort and how the procedure goes. It's on a 5-second interval. So those first 2 seconds are the cooling, and then it goes to warm and then hot. But typically by the time you're already getting to that hot sensation, I'm already moving on to the next area of the treatment.
So truly it is very tolerable. If anyone has had a laser service before, that pain level is totally different, and we do different things to prepare you for that. We actually have the Pronox that we can use. Very tolerable. Let's see. We talked a little bit about pricing, talked a little bit about pain. Someone's asking about the submental area, the excess skin under your chin, and that is one of the main FDA approvals and probably the most requested area to be treated.
The most requested area is underneath this submental, right around here, as well as that jowl area to give us a nice good lift and tighten.
I mean, some people are even doing this preventatively. I don't know if you guys kind of saw the hype recently with the Kardashians. I did a little bit of digging, and I actually was at a webinar that the doctor who treated the Kardashians was at, and he said they did not get paid. I thought for sure they would have been paid a big sum of money. They did not receive any money for that. They had somehow had a Sofwave treatment a couple of years ago and requested to come back. And he did say that they had body parts done that aren't normally done, whatever that means, but they truly loved the treatment and the results that they asked to come back for more. So true story. They did it for free.
Yeah.
Nothing's for free, but they didn't get paid for that.
Another one of our questions here is, what are the side effects? For Sofwave, the best thing and why we brought it onto our practice here is that it is really perfect for honestly anyone, all ages. It's great for all skin types, and all colors of the skin as well. As far as side effects go, you may notice some swelling and some redness in the skin, and that is a-okay. That will totally subside between like 24 to 48 hours. It may be earlier. It really just depends on how sensitive your skin is, but those are the clinical endpoints that we are looking for, is some redness and maybe some slight swelling. As far as side effects, that's honestly really there is to Sofwave. So that is another reason why we brought it onto this practice, is that it is safe for almost everyone.
Like I said, I did go out for a concert that night. There's no downtime. So some people right after the procedure will say, oh my gosh, I already feel tight. Whether that's placebo or not, I don't know. Typically the results aren't seen right away. They're seen at about 3 months. But I think maybe something just about the ultrasound technology and the heat and where it's reaching in the dermis does actually make them feel a little more taut, which, you know, hey, placebo or not, if we feel better, it's all the better. Let's see.
Another question is, sorry, I cannot see. How well does it work on crepey arms? It is actually FDA approved to help in that crepiness of the arms, as well as your belly region for someone who might have lost a lot of weight recently or whatever the case may be, it does help in those certain body areas. So yes, it does help with the crepiness in that arm region.
Yeah, we've actually already seen that. Someone during our training actually was a model, and we did her, and she came back and wanted a second treatment because, again, it was for a modeling situation, and we already had seen pretty amazing results. It's off-label, but we have heard that people like to do their knees. Sagging knees is a real thing, and if you tighten up the skin above the knee, it kind of pulls that up a little bit. So yeah, abdomens, obviously face, neck and chest. Décolleté, I've heard people want to tighten up the décolleté skin, arms. There's really no other areas above the brow. Yes. So we would assess you to see if it's a lid lift that you're needing or a brow lift. They both are kind of affected with this device. Are you able to go grab the handpiece just to show them? With this device going right under the brow bone, it can do both. So we'll take a look at you and see, is it a brow lift that you're needing, or do you have a little bit of the excess skin on your lid? And it's pretty impressive, up to a 4 millimeter lift. Obviously, we can give some brow lift with neurotoxins, which is amazing. And again, you can do both of these things, not at the same time. Well,
yeah,
Sofwave first and then toxin.
Yeah.
But it's pretty impressive. We did have a patient who was treated on her forehead, and she called us back not even the 3 months later and said, it looks like I received a brow lift.
Good.
It's just impressive. It all sounds too good to be true. Thank you so much.
Which kind of leads me into this next question. It says, how does this work if you're already using Sculptra? I'm assuming there was a little bit of a typo, but I'm assuming that is what you were meaning. Actually, it works wonders with Sculptra because that is a collagen producing formula that we are putting into the skin, and with the use of Sofwave, we are stimulating collagen and elastin production. So pairing those two together actually works really well. You can do it in the same day. We would want you to do Sofwave first, though. There's no contraindications of doing both of those treatments, and it pairs wonderfully as well.
Yes, this treatment done either alone or in combination with any of our other treatments, be it laser, good skincare, toxins, Sculptra, filler, PDGF, just elevates the results even that much more. And I really think that people are looking more and more, as I mentioned in the earlier portion, for regenerative things. So let's capture the power of your own body to help rejuvenate, regenerate, and turn back that aging clock. I wanted to show them just a little bit.
Yeah, of course.
So you are the one that does the procedure. So if I was getting a treatment done, I'd be laying down, and let's pretend I want neck and lower face.
Yeah. So it kind of works like this. It has 7 beams on here that is sending out the ultrasound to the skin. It would work like this. You'd hold it, and like I said, it is that 5-second interval. It will beep at me when I need to go to the next section, and then you just kind of go over, and then again you'll do it again at a 50% overlap. So it's super quick and easy procedure as far as the treatment itself.
Okay, what else? There's some other things kicking in here. Oh my God, I feel so old.
How many treatments does someone usually need? This is something we would decide at our consultation that we would have, but typically between 1 to 2 treatments is needed. You don't typically see results until 12-week, 3-month mark. So you will come in for a post follow-up. We'll take pictures then and there, and we'll kind of compare and contrast before and after pictures. And then we'll decide, do you love the results after 1? Do you want maybe more right here? And we can do a second treatment. If you love it after 1 treatment, then I would recommend it as a yearly maintenance situation, coming in and getting that done. As far as body goes, if you're doing it in the arms, where we were talking about a little bit earlier, in the crepiness of the arms or the kneecaps or the belly region, that requires 2 treatments no matter what. Instead of 1, it is 2 treatments.
Something that we had mentioned earlier, I'm not sure if you guys caught it or not. So a lot of these procedures increase collagen and elastin. collagen is like the scaffolding in your skin and elastin is the stretchability. What Sofwave does, it's pretty phenomenal, is it actually is hitting the hyaluronic acid in your skin. It's really one of the only devices that can do that. So that's how it differs than lasers or something.
Discomfort. A lot of these questions are the level of discomfort with the treatment. Like I said, it's pretty minimal to no discomfort. Obviously, I can't speak for you. Everyone is their own person. But like I said, it's kind of a cold, warm, hot scenario. The clients that I have treated have spoke and said that it's pretty good. But yeah, cold, warm, hot. And by the time that it's already heating up, we're kind of already moving on to the next section of your skin. It has a skin temp on that. So we're heating it up to where it needs to be.
And for people who are a little bit more anxious, anxiety ridden for any discomfort, we do offer Pronox, which is basically like laughing gas. It's a mixture of oxygen and nitrous oxide. You control it. So you're kind of sucking on the machine to get as much or little as you want. You still know everything that's going on. You just are a little bit more relaxed. And you can drive yourself home. It's out of your system within 10 minutes. So that's something for anyone who's a little bit anxious and nervous about the procedure.
Yep. And you do, and we do have you numbing for about 30 to 35 minutes. I see a question here, is numbing required? We recommend numbing. However, if you don't want to numb, you don't have to numb. We just recommend that. Like we said before, we do offer a Zimmer, which is cold air blown at yourself. You'll have it in your hand and you do it for any discomfort that you have. So there are multiple things that we help to get over the discomfort that you may have.
Let's see here. Again, back to how long the procedure takes. Probably for the smallest amount of time, if you were just doing a brow lift, after the numbing, the procedure itself would be 20, 30?
Like, depending on the area, of course. It can vary anywhere between 30 to 45 minutes.
And that's getting all the areas done, obviously.
Yeah. And you will find that out in a consultation. And by the way, if you book a consultation by April 15th, you can qualify for our exclusive offer of buy one Sofwave treatment and get a second one half off.
We're pretty psyched about this. So the technology has actually been out for about 6 years. So the results are proven. I never jump on board to get something right when it comes to market. I kind of wait for any kinks to get out and make sure that the results are proven. And these are, in fact, Sofwave, the company, came out recently with a new protocol to save time and increase efficacy. It's something called treat to total energy. So they did change the protocol actually just right when we brought the machine on. So it's quicker and it's more intense energy to the area that we need treated. Shannon actually learned both ways.
And I love the treat to total energy. It's so much better.
So, things evolve and change and you learn as things go along. So it isn't a new device. It has been on the market for about 6 years.
Some of this says, can you target the neck? Yes. Again, that's one of our most sought out treatments is the neck and underneath that submental area. We have another that says, can you get it done under the eyes? Yes. Again, you can get it underneath the eyes and up here to give you that 4 millimeter brow lift.
Some of these are kind of repeats. Ages, like we said earlier, everyone is a candidate. Some younger people are coming in, even in their 30s, if they're just kind of starting to see some age-related changes and doing it as more prevention. We've had kind of all ages, in all honesty. So it works for a lot of people.
This says, does it light up like a laser? No, it is ultrasound therapy. So we actually aren't targeting the epidermis of our skin. We're going into the mid-dermis around 1.5 to 2 millimeters where the collagen and elastin fibers are found. So that is what makes it non-invasive. You aren't going to be leaving the clinic feeling hot or any residual pain. Once you get off that treatment table, you're A-okay to go back to your normal lifestyle.
I'm going to speak to just a little bit. Anytime like a laser or microneedling or Sofwave is done, what we're doing is actually creating a controlled wound. So when the body senses a wound, it sends, the body initiates a wound healing response, which is when all of like the collagen, elastin, and all the good things come to heal a wound. And that's kind of what we're doing. It is essentially a controlled wound. We want the wound because we want that healing process.
We have a couple here that says, how long does the results last? They last anywhere to a year to a year and a half, depending on if you're keeping up with that yearly maintenance, and also are you pairing it with good skincare at home or other treatments such as Botox and filler and Sculptra or laser, or even just a basic monthly hydrofacial. So yeah, they can last up to a year and a half.
I saw a question on here about how does the pain compare to a Halo or Moxie? It's less.
Yeah, I haven't done it yet.
I've done it all. And like I said, I am probably the biggest wimp in this office, if not in the world. So with the Moxie or Halo, I do it because I love the results, but I typically always use the Pronox. And again, with Sofwave, I did not. So oh, there goes my earring. A Halo or Moxie differs from Sofwave in that it can target the pigment too. Sofwave is not going to work on rosacea or any pigmentation. It is really just going to do lifting and tightening. That's what it's indicated for, and that is what it does.
As far as discounts treating multiple areas, if you book a consultation by April 15th, you will be in an exclusive offer to buy one Sofwave treatment, and you'll get the second one at a half off discount price.
Our consultations are all free. You would just call or book online. You will come in and see Shannon. She'll go over your medical history, take a peek at you, figure out what treatment would be appropriate, whether it's severe, mild, moderate, and you would know all of that pricing before you left. And she would take pictures at that time. You'd come back on another appointment and get the procedure done. And then typically 3 months later is when we want you to come back and let's evaluate and let's take pictures and let's see the amazing difference that you have. Some of these are repeated. Let me see if anyone has maybe a question that hasn't been. And you guys Google it. Go look up Sofwave and see the before and afters, hear testimonials about it. I am pretty skeptical when it comes to devices in this industry because not all, even though they have bells and whistles, not all of them work. And I brought this on because it works. We've seen it. We've researched it. The science behind it is pretty incredible. And it really is the real deal.
A lot of these are some repeated questions about how long the results last and the pain management, which we've already discussed. So
someone asked about M-tone. M-tone is more indicated just for cellulite. Sofwave does do cellulite plus other things. I don't know, depending on how deep the cellulite is and the area, we could kind of tell you which device we think would work best for the cellulite. So it is different than M-tone.
Another question is, if you have a Sofwave treatment, how long until you can do toxin, Sculptra, or other services? Actually, the good thing about this device is that you can actually get off the treatment bed and go over to our nurse injectors and go get that toxin and Sculptra. There is no contraindication of how long you do need to wait in between the treatments. So you can get the treatment done and get another treatment done in that exact same day.
In that order, like she said. Yep. So we would want to do the toxin, filler, Sculptra, PDGF after Sofwave. But yeah, it can be done at the same time. Let's see here, guys. And we will see these questions. So if there's something that we did not answer, we can email you with the email that you had signed up for.
This one says, can you apply makeup after the treatment? Again, yes, you aren't leaving the treatment with any microchannels or micro injuries to the epidermal layer of the skin. So yes, you can put makeup on, you can work out after, you can totally go back to your normal lifestyle after this treatment.
There was a question about hands. I don't know. I can certainly get back to you about that. We do, like I said, elbows, arms, knees. I don't see why you couldn't do hands. I have not seen it or asked that, but I will, because to me, the technology makes sense that we could.
Also, as a reminder, you will be receiving a text message at the end of this Q&A event, and then you reply with Peer to be contacted for a consultation here at Pier 111.
And that is pure, not peer.
Pure.
Pure.
P-U-R-E.
Let's see here.
The magic word.
Yes. Can you do it on thighs? Another great question. But clearly, if we do it on knees or right above the knee, yes, you could do it on thighs. The contraindication. If you have cochlear implants, it's a contraindication for you.
Pretty much any metal implants in the area that we are working in, and cochlear implants, and of course pregnancy and breastfeeding. As far as any other contraindications, we haven't ran across any yet, but those are the main concerns that we look out for. Unfortunately, if you do have these, then you cannot get the treatment done. No ifs, ands, or buts.
Cellulite on thighs, yeah. Mm-hmm. Again, whether it would be Sofwave or a cellulite, we could kind of look at you and tell what we think would be the best option, or a combo of two.
This one says, again, cost per treatment, is neck included with face, or will that be 2 treatment appointments? Yes, it will be 2 treatment appointments. However, we can treat the face and the neck in the same appointment at a different cost rate. But we will figure that out in the consultation.
Let's see here. We do have, someone's asking about discounts and stuff. We do have a membership at Pier 111. You pay $150 a month. It's basically your money being banked. So after 4 months, you have $600. And every October is our big annual sale event, at which time you can choose to buy into a tier, which is 10, 15, or 20%, where you have that percentage off of any service, any product, anything we bring on, anything we do for the whole year. So, and you can even combine the tier, let's pretend you get 20% off, with the membership. So after 3 months, you have, $450 saved up, and you get 20% off. So it really does make sense.
We call it a health savings account, if you will.
It's like your HSA.
And it is a great thing to invest in if you are wanting something like this that are a little bit higher priced, something that you might need a series of 1 to 2 treatments. Again, it really does help. And not only is the 15, 10, or 20%, it goes towards everything in the clinic, whether it is filler, Botox, skincare, lasers, or hydrofacials. So that is also a plus.
Let's see. Again, someone asked about how long you have to wait after neurotoxin. If you get the neurotoxin first, we will have you wait 2 weeks. But the other way around, you can get it, like we said, the same day, same appointment.
One of these questions says, what if you have braces? That is a really good question. I have never even thought of this, so I will definitely write your name down and I will get back to you after I figure out this question for you.
That's a good question. That's a new one.
Again, how long should you wait after tox? You can get the treatment done and then you can continue going right over.
So it looks like a lot of these are repeat, you guys. If you think of something, you can certainly email us at info@pier111.com or text our phone number. Again, if you book a consultation by April 15th, you will qualify for the exclusive offer, which is buy one area, get one area half off.
And follow us on our Instagram at Pier 111 Medical Aesthetics. And that is where you will see all of our posts.
And remember to reply to the text that you are all going to receive. And we'll pick the raffle winner tomorrow. And you should go this weekend to Leono because it's pretty amazing in O'Fallon. Yeah. Thank you all so much for taking your time with us and amazing questions. We'll find out the answer to a few of these and email you. Reach out with any other questions. Call the office, book online, or just pop in. All right.
Awesome.
Thank you all.
Well, thank you so much for joining. Bye.
Bye-bye.